Now join Professor Karol Sikora, oncologist and former director of the World Health Organization Cancer Programme. Karol, really good to talk to you as well. You've been obviously commenting on this. You know, look, at the end of the day, 1 in 2 people gets cancer. You know that more than anyone, and it is a shock. It's devastating, and you almost go through bereavement, don't you, when you learn of a diagnosis?
Absolutely. For someone at the age of 42, it's probably her first brush with the idea that she's not going to live forever. And for the rest of the family. None of us are going to live forever, as you and I well know. So, but it is a real shock to the whole system, shock to the family, shock to her, shock to the public in Britain who love her. And it's clear she's the most popular royal, and we all wish her well, I guess.
Absolutely, and of course there's been fevered speculation about what's been going on. I don't want to speculate, and it's none of our business actually what cancer she has or indeed what she's been treated with. But just can you reassure, I mean, my understanding is she went in, she had an elective procedure, that means it was planned. She says in her own words she had preventative chemotherapy. Can you just sort of explain to people what that entails and why?
She's had surgery to remove the cancer, and maybe the whole cancer's been removed. We don't have the details. It's likely that there were certain features of it. You know, when you and I were at medical school, the features looking down a microscope in the pathology lab. Nowadays, the features are that, but as well, looking at the molecular structure, the DNA of the tumour. And certain signals in the DNA suggest that the prognosis may not be so good, and that it may have a high risk of coming back. Those patients receive what she called preventive therapy, what we call adjuvant therapy, to help progress. And adjuvant therapy in many cancers has a real proven value. It improves response, it improves survival by about 20% for many patients. So it's worth doing in certain people. And as you well know, David, the future of cancer is about personalising the treatment. So Mrs. Jones and Mrs. Smith, same cancer, exactly the same to look at down the microscope, but they get radically different treatments.
Let's just broaden it out, because it isn't just about Kate, it's about the millions of people suffering from cancer in this country and around the world. I think that's a really optimistic note. The way that therapies are evolving, it's so dramatic, isn't it? And you allude to it there. The fact is that we now have tools available that we never had.
Absolutely. And the future is about molecular biology. You know, DNA was discovered in 1953. I was alive at the time. You weren't.
I was not.
And you know, by Watson and Crick in the molecular biology lab in Cambridge. And that revolutionized our ability to understand bodily function. And cancer is the disease of molecules. It's a disease of growth control. Mechanisms such as placental invasion during pregnancy require invasion and spread of the placenta. Those signals get subverted in cancer, which allows cancer cells to spread in the same way as the placenta does in the womb. So clearly, the future is by understanding the mechanisms, the molecular cogs, if you like, we can actually develop new treatments that are personalized and would have much reduced side effects.
Now, Renee and I spoke earlier about when you hear that word, there is, I mean, cancer isn't one disease, is it? It's multiple diseases, and they all have different prognoses and so on. But just in terms of this, there has to be an upside. And I guess that upside is if you're worried, seek help.
Yeah. There's no doubt. The upside is you can learn to live with it. You know, I can tell now, because I'm such an old oncologist, I've been doing for nearly 50 years, when someone walks into the room, a patient walks into the room you've never met before, you can tell within about 10 seconds how they're going to behave, how they're going to tolerate treatment. If Kate walked into the room, I would say she's going to do fantastically well, just by her whole attitude to it. Attitude, you know, clinical trials have tried to demonstrate positive attitudes that benefit, but everyone's different. It's, you know, for some people, they're really quite positive, but it doesn't come out because they're very shy and inward looking. But that doesn't mean they can't be positive. And it's not just about the chemotherapy, it's about the mind, body and spirit, which she mentioned in the video. that we saw. All those things, all three of them, the trinity of body, mind and spirit is really important for cancer survival.
And you and I have spoken at length about our cancer survival rates in this country, which fall way behind many European countries. What do we need to do to the politicians? What do we need to do to ensure that actually we have world-class cancer care in this country?
We really do. There's nothing wrong with it once you get it. It's the delay in getting diagnosed. You know, I was in Poland last week visiting the Krakow Cancer Centre. My family were Polish. And, you know, the aim there is to treat people from diagnosis within 12 days. Here, the target is 62 days, and 40% of our NHS trusts are missing that target. It's the same thing. It's called NFZ over in Poland. It means NHS, and it can do it in 12 days. How can that be that we have to take 62 days as a target and can't even meet that? If we speeded that up by whatever mechanism, working at weekends, filling hospital car parks at night and so on, we would have tremendous improvements without any new technology.
And I'd agree totally. I've been through this with a family member, or two family members, but when you're in the system actually works brilliantly. I cannot complain about the care that my mum has had, for example. It's been exemplary.
It is getting into the system. It's not the fault of general practice. It's just the whole system is clunky. And it's multiple queues. It's like a busy airport on a bank holiday weekend. You go through multiple places where you're queuing again before you get to the plane. And it's the same in our NHS. It doesn't work like that in other European countries. It's not that you have to pay. They're universal systems, just like the NHS, but they work much better. And, you know, hopefully, if the new government gets in, they'll put a lot of effort into getting it to work, because it certainly has gone down the tubes in the last decade.
I would agree. Karol, really good to talk to you. That's Professor Karol Sikora there. Thank you very much indeed for your time. As you would expect, of course, lots of outpouring of really lovely thoughts and sentiments actually from the White House in the United States. I said Jill Biden, also Boris Johnson wishing the Princess all possible strength, Justin Trudeau sending his support to the royal family, Michelle O'Neill wishing Kate a speedy recovery as well. I thought there was a lovely one, Renee, from her brother.
Yes,
James.
I saw that, about mountains.
Yeah, he published a really moving picture and message on his Instagram following his sister's announcement. Alongside a young picture of himself and Kate, he wrote, "Over the years, we have climbed many mountains together. As a family, we will climb this one with you too."
Lovely.
It's really lovely.
And that's what it's about. It's about everyone pulling together. I mean, I actually think to this day that when I got my diagnosis, my mum was worse affected than anyone. I think for her, being helpless as her daughter...
Oh, it's dreadful.
Yeah, I think... You know, you have to think about the people around her.
I mean,
as well.
one other thing, I don't know what your view is. Lots of people are saying, well, it's all very well for her because she's got private healthcare and all the rest of it. I don't buy that, actually. It doesn't matter because, as I said, we've had exemplary care in the NHS. And when my father was diagnosed, we went privately and we didn't get good care.
Well, nor did I. So I did the same, and actually I would have been better to go to the Marsden for a second opinion. Yeah. So actually that's not true. I think what we're talking about here is not the treatment. What we're talking about is the whole concept of having cancer.